Welcome to my instructional video on knee arthroscopy and partial medial meniscectomy, the removal of torn meniscal cartilage from the knee. This patient had swelling and pain along the medial or inside portion of her knee, along with mechanical symptoms including locking, catching, and popping. Initially, upon entering the knee, I can see a large flap of torn meniscal cartilage that can explain the patient's symptoms. A systematic examination of the knee, including the ACL, the lateral meniscus, the patellofemoral space, the suprapatellar pouch, and the medial and lateral gutters is carried out. A complete and thorough exam is essential to ensure that you haven't missed any other abnormalities in the knee. Once I am satisfied that the remaining portion of the knee is normal, as in this knee, I return to the area where the torn medial meniscus is located. The previously identified tear has already been trimmed to allow better visualization of the posterior or back half of the knee. A probe feels for any flip fragments and gauges the extent of the tear. The shaver is then used to remove any loose debris and help see the remaining torn tissue. Care must be taken not to injure the articular cartilage at the end of the bone, as that has very limited ability to heal. An aggressive biter is often used to trim the torn tissue back to a stable rim. Meniscal tissue is made of very tough fibrocartilage and requires some force to bite through it. This biter allows me to trim the meniscus and get a feel for where the abnormal tissue ends and the normal begins. I always try and leave as much normal tissue as possible. I can see that there are still some abnormal and torn fragments in the very back portion of the meniscus, and a biter is used to smooth that out. Lastly, a small hooked instrument is used like an extension of my finger to feel and probe the remaining tissue to make sure that there are no remaining tears, loose debris, or flip fragments that can be causes of pain later. Pictures are taken throughout the procedure, and I will give you a copy in the office at the first visit. The knee is thoroughly washed out, stitches are placed, and the short road to recovery is started. Most folks are off of crutches and pain pills within a few days. Physical therapy is started within a day or two, and most people can tell that the symptoms that brought them to the surgery quickly disappear.